Last summer, the Trump administration announced a dual-pronged plan that could lower the cost of prescription drugs. This fall, Senator Michelle Benson, chair of the Health and Human Services Committee, held listening sessions around the state to hear from Minnesotans directly about managing their prescription needs. She now joins me in the studio. Thanks for being here.
Glad to be here.
Before we go into the details of the administration's plan, tell me about these town halls. What are Minnesotans concerned about? Are they really struggling with these prescription drug costs?
Well, we've seen as policymakers and as somebody who watches the insurance industry that prescription drugs become a larger and larger part of the cost of health care. Some of that's good. If a prescription drug is keeping you out of the hospital, it's actually lowering the overall cost of care. But because there are high deductibles and co-pays, a lot of people are feeling the direct impact of the high cost of their prescription medications. And we're hearing that there are new seizure medications that came out in 2018 that are revolutionizing the way seizures are treated, but they're expensive. They're new. British company rolled them out, and it's painful to hear people talk about how they can't afford this latest medication and how the other ones aren't necessarily working for them. And so it's good motivation for us to keep pushing on this issue.
The first prong of the Trump administration's approach would allow states to import certain drugs from outside the U.S., places like Canada. Many prescription drugs are significantly cheaper in Canada. So what would Minnesota need to do to gain access to these lower Canadian prices?
Well, we would have to allow, it's the mechanism of a wholesaler in Minnesota having a partnership with a wholesaler in Canada, because we want to make sure we have full traceability and trackability on these drugs. It's important for safety that they not be adulterated drugs that came in from another country. So we want to make sure we know where they came from the manufacturing process all the way to reimportation. And so that's going to require some legislation, and it will require us to have our Board of Pharmacy do some inspections at those wholesalers and verify these relationships. And so we're working on language now, and we're working with all the stakeholders who would be impacted by this. And there's some openness to it, but as with everything, there's concern about how it's actually going to work when it's implemented. If you remember, the Pawlenty administration started doing this.
I was going to mention that. Yes.
Yes, and so we have some of that legacy here in Minnesota, but with the 2013 Safe and Secure Drug Act, we have this added wrinkle of full traceability, which I think Minnesotans want. They want to know their drugs are safe in the supply chain.
Now, which drugs qualify for this? Because it's not all, is it generic, is it name brand? Does it affect insulin?
Well, and it would have to produce significant savings. It couldn't be infusion drugs. And the question about insulin is it a biologic or is it a drug? So we have conflicting parts of code right now. And when we asked our colleagues in the federal government, which one is it, because we see it in two places, they said, well, we'll get back to you. So March, we're supposed to have an answer, because it's not just Minnesota that it's impacting. It's the industry and how it's defined, how insulin is defined. But there would be, it would be limited drugs, because Canada doesn't have the full formulary that Minnesota has. Probably not generics, because we already have cheaper generics than they have in Canada. Nothing that would be given in a hospital or in an infusion center. And so it's not a panacea. We're not trying to sell it as that. What we're trying to do is get the pharmaceutical companies to stop treating Canadians better than Minnesotans. We want to be treated fairly. So if you can get an Advair disc in Canada for $6 and it's $60 here, that's not fair. So let's figure out how we get pharmaceutical companies to change that behavior. And if this is what it takes, this is what we'll do.
The other part of the Trump administration plan, the second pathway, would allow pharmaceutical companies to verify that their foreign-produced drugs achieve the same safety standards and protocols as American counterparts, and then offer those foreign drugs for sale in the U.S. at the lower price.
Right.
What is the incentive for the pharmaceutical companies to want to do this?
Well, first of all, they need to treat Americans fairly. And I think having these intense conversations about the cost of prescription drugs is resonating with some of the pharmaceutical companies. But they're kind of stuck. Let me tell you why. There's something called a national drug code, And all of the rebates that are required at the federal level peg off that national drug code. And so, for example, you'll have drugs that have 4 different categories of federal rebates. They put a price on the national drug code, and in the private market, that price is what you see, even if you're not getting the federal rebates. But if they put a different national drug code, those rebates at the federal level don't apply, so they can actually just lower the price and make it more transparent for consumers. And so there's some interest. We have started talking with pharmacies to see how this would work for them, distributors to see how it would work for them, and we want to sit down and partner with some manufacturers who are going to have the biggest impact. And it's not just their foreign produced drugs. There are drugs that are produced here in the United States that are labeled for foreign sale in Israel and Ireland. They could just give them a different national drug code, avoid this whole rebate mess, and make it available at point of sale at pharmacies.
Now, pharmaceutical companies do have an interest, though, in a certain amount of return on their investment for research and development. So how is there a balance? How do you balance that?
And we want them to be sustainable. That's how you come up with new seizure medications. That's how you come up with new medication or drugs that treat specific genetic disorders. And so we don't want to have a chilling effect, which is what some of the foreign countries' behaviors actually have a chilling effect on R&D in their country. And so by letting them have this second national drug code and not be subject to the rebates, there are some rebates where the state of Minnesota actually gets more in rebates than we spend on the drug. And so the manufacturers, this gives them a back door. It gives them a different way to get the necessary pharmaceuticals to the people who need it at a price without the rebate game.
Do you expect there to be bipartisan support for this?
I think because we're moving into an election year, my hope for bipartisanship is slipping a little bit, but I hope that I can put forward a reasonable, well thought out bill language that somebody could look at and say, okay, we can live with this. And if it doesn't pass this year, we can bring it back when it's less political and when it's not an election year.
Senator Michelle Benson, always a pleasure.
I'm glad to be here. Thanks for having me.